My name is Dr. Chaand Nagpaul. I'm a GP. I've been a GP for 35 years, and I'm representing the discipline of general practice, primary care. I chair the North West London group of GP practices, and I also am a member of the Royal College of GPs Council. So I'm running a workshop on the challenges and opportunities for primary care, and I think it's really important to remind ourselves that 90% of NHS contacts actually occur in general practice. And also today's conference comes on the heels of the publication of the Darzi report that just highlights that, in fact, if we are to see a sustainable future National Health Service, we do need to invest and enable GPs like myself and other healthcare professionals working in general practice and primary care to be able to deliver the care that our patients need. And at the moment, we are woefully under-resourced. And again, that was very explicit in the Darzi review, that in fact, we've seen an erosion in the funding of the NHS pot that's come to primary care, the total reverse of what should be happening. And we've also seen workload escalate that affecting GPs and other primary care professionals. And we've seen actually a reduction in the number of GPs over the last 5 years, whilst at the same time, we've seen a 19% escalation in volume of care in general practice. So I'm going to be talking about how we address that mismatch between growing demand, diminished resources. Obviously, the government has to tackle that in terms of funding the NHS in a more appropriate manner, but also strategies that we can do as healthcare professionals together with our patients to try and provide a better service. So this is very much about strategies that we can implement today whilst we see, I hope, a better future with a better funded and properly resourced NHS. So what I really like about the Apna conference and what's so important is that we know that South Asian professionals make up such a vital part of our healthcare workforce. More than 4 in 10 doctors come from ethnic minorities working in the NHS, the majority of whom are South Asian. And we have so many other South Asian healthcare professionals, nurses, health visitors, people involved in tech, people involved in leadership roles. And actually, I think bringing all of these professionals together to come up with some solutions or collective thinking is a wonderful opportunity. And I'm delighted to be part of this. I've seen Apna grow as an organization from nothing, effectively. An organization that was created, in fact, in the midst of a pandemic. And I'm very proud to see how we have brought together a collective of healthcare professionals who work in the National Health Service to be part of one team in the spirit of the word Apna, our own. And I just hope that this will develop further. And really, I think, untap the full potential of our South Asian professionals working in NHS. So this is about a positive message. It's not a message of just campaigning for change. It's a positive message of unleashing the full potential of our South Asian professionals working in the NHS.